So we have a really exciting sets of things to talk to you about tonight, and well, we'll make sure that everybody goes back and looks at the video that we did on prescription renewals, and that's a really important one that everybody should look at some point in time. But tonight we're going to see that how we maximize your health by working with your pharmacist. Marie, take it away.
Yeah, so hi everyone, welcome to our webinar tonight. My name is Maria and I'm currently a second year student studying health sciences at McMaster University. And I just have a team of volunteers with me today who helped me work on this presentation. So if everyone would like to introduce themselves.
Hi everyone, my name's Aislinn. I'm in my third year of studying kinesiology at McMaster.
Hello everyone, my name is Stuart. I am a fourth year Bachelor of Health Sciences student at McMaster University.
Hi everyone, my name is Subin and I'm also a second year student studying health sciences at McMaster.
And I'm Greg Cernu. I'm a 35-year student at McMaster, still learning every day as I go.
Hi everyone, my name is Hafsa and I'm in my third year studying Blister at McMaster.
Okay, great, so we'll just get started, and Stuart will also be monitoring the YouTube chat throughout the live stream. So if anyone has any questions, just feel free to message the chat. All right, so up first we have one more introduction from Rami. So Rami, if you'd like to introduce yourself as well.
Yeah, my name is Rami. I'm a registered pharmacist in Canada for the last 13 years, a pharmacist for the last 23 years, and I practiced in British Columbia, and for the last few years I've been in Ontario. I'm happy to be with this group.
Amazing, thank you, Rami. So Rami will also be just commenting throughout the slides and then giving us his expertise on how the pharmacy side of things works. All right, so first we'd just like to introduce you to some of the pharmacy services that are provided at Shoppers. So Rami, if you'd like to comment on some of these things, there'll be 2 slides for this. I'll be clicking through them as you go along.
Sure. So part of what we do at our pharmacy is many services besides the filling of prescription, which people might think it's the main thing we do. We actually have lots of other stuff that we do also. Prescription renewals is a service that we do renew prescriptions for chronic illness like diabetes, heart problems, and other chronic medications like also blood pressure, with the qualified type of depending on, of course, the criteria and the patient present. So in the patient record at the pharmacy. So that's the prescription renewal. Medication disposal. If you have any medication that you are not using and you want to get rid of it, it's always a great idea not to throw it in the garbage. It ends in a landfill and it ends in the water that we drink. So basically, all what you need to do is just bring it to the pharmacy and we will dispose it properly with a company, and that's a free service. We pay for it, but it's a free service for the customers. We also, in this location, just below Dr. Gurnu's office, we do the asymptomatic testing for COVID. And this is mainly for people who are visiting retirement homes, working in, there's a criteria for it, for teachers, for people who are working with elderly or shelter homes. We do all the asymptomatic testing as part of what we do, and also this is not paid by the customer or patient. It's a service that we were selected by the government because of the location in the area where the COVID has been showing a relatively higher percentage than other areas. Medication reviews. This is a great service in which we reconcile all what the patient takes in terms of medications, including their over-the-counter, the natural health products they use, and believe it or not, with every single medication review, there is always an added value for the patient as well as for the doctors. We communicate that to the patient directly. We do it over the phone for the current time, and we also do it in the pharmacy. You just need to ask for it, or we try to offer it for eligible people. Every single resident in Ontario, regardless of their age, who takes 3 medications chronically, they are eligible for this service. And there's a follow-up service too. I advise strongly people to do it because there is always new things coming up. There is always new updates on your health, and the medication review is the main way to find what exactly you can optimize your therapy. The A1C testing, we started recently with a testing where we can test the cumulative blood sugar for people. During the COVID year, many people missed their appointments for lab tests to get their A1C testing, and that made the diabetes tracking a bit hard. So we offer now the service at the pharmacy. Within 5 minutes, you will be able to know what's your A1C, if your blood sugar is well controlled, and we fax your doctor with the results. And if there is any recommendation, we do it to the doctor and to the patient at the same time. Vaccination, we vaccinate people all the intravascular injections, what we call the travel vaccines. Nobody's traveling now, but we know for a fact that many of the traveling is purely many of the vaccines are available at the pharmacy, and there is one of them that you even don't need a prescription for, which is called Prevenar. All what you need to do is just ask your pharmacist. You can buy it over the counter, and the pharmacist can inject it for you. So these are a quick shot of what we really do at the pharmacy, and it mainly helps the circle of care. It helps Dr. Cornu and other physicians. It helps us, and it helps the patient to optimize their therapy.
So Rami, could I just ask you a question? You mentioned Prevenar. I saw those TV commercials about them. So tell me about there's 2 vaccines for pneumococcal. Tell us just, we did a previous webinar, but it's worth mentioning that again. So tell us about Prevenar and pneumococcal vaccines. Who should get it and when?
Well, it's an excellent question. Prevenar is really advised for all patients, but especially over 50. I'm sure you're the expert on this, Dr. Cornu. Pneumococcal infection might cause lots of bad reactions to your heart and your vessels. And if you have a cardiovascular issue, it's always a great idea to get the Prevenar pneumococcal vaccine so that it can help to decrease the chances of getting a worse case of a cardiovascular reaction. So anybody over 50 is extremely advised to do it. But in general, even if you're 40 and you have a heart problem, or you have you're diabetic, or go ahead and do it. If you're 30, there's no harm at all of doing the Prevenar at any stage of your life. We know for a fact that it depends on their age. The younger population might have it already with the family physician, but the older population needs always to be updated about their vaccines, and Prevenar is one of those. The only reason we need a prescription for Prevenar is if you have coverage. The coverage insurance plan will need a prescription to get it covered. But if you don't have coverage, you can always buy it from the pharmacy, get it injected, and have a record for it. So that's the very important fact about the Prevenar.
Thanks so much. As you know, I'm asking questions, and I want to encourage everybody to ask your pharmacist a question. And tonight, Rami's going to answer any questions that you had. Next slide, please. Also, organizing medication. Blister Packs.
why blister packs are a good thing. Blister packs are extremely important for patients. I am personally, I'm going to share with you something. I'm 45 years old. I have a diabetic type 2 profile, and believe it or not, I'm a pharmacist, but I also put myself on blister packs. What happened is before that, I used to take medication in vials. I ended up getting higher need for diabetes medication because I wasn't.
So Rami, we're going to talk about blister packs in more detail in a second. I just want us to highlight some of the things that you get at the pharmacy And we have, from smoking cessation to traveling to monitoring your blood pressure, electron kit. So we're going to talk about this in great detail in a few minutes from now. So let's go to the next slide if we may.
Sure. So Rami, a question for you. Do you do delivery to homes for drug prescriptions?
Yes, of course. We deliver everything related to medication as well as front store items free. You don't pay for it as a patient or a customer. To almost every corner of Hamilton. We don't go that far. We don't go to Flamborough or Niagara or Grimsby, but we still can arrange Stony Creek and Ancaster for sure, and the mountain. All what they need to do is just speak to me, ask for Rami, and we will arrange it for them. We do deliveries on daily basis. In some instance, we also do Sundays at some point. Depend on the situation. We do delivery 6 days a week, but if there is an emergency, we have to deliver on Sunday. We arrange a delivery that we pay for in order to make sure that patients get their delivery on that they need. So delivery is very open in Hamilton for people, and we encourage people to use that service, especially if they don't want to leave their houses.
You can see that pharmacists now are really coming up to the plate in this pandemic. I'm going to encourage people to walk, and you have to decide if you can walk or need a delivery. So, thank you.
So now we'll just be going straight into the presentation. This will be our agenda for today. So we'll start off talking a bit about prescription renewals, how that process works, a bit more about blister packs like the intro that Rami gave us earlier, and then we'll talk about how we should visit our local pharmacy and the different questions we should have for our pharmacists. And then we'll go into a bit about the generic versus brand name drugs, some drug interactions to be careful of, and at the end some helpful tips, especially with drug plans and costs. Okay, so starting off with prescription renewals, this is always an analogy that Dr. Kernu likes to use, but let's say you're driving on the road one day and then all of a sudden you run out of gas. Or if you're driving an electric car, you run out of electricity. What do you do then? Well, you can maybe call or wait for help. Someone can come give you some gas, or maybe you can manually push your car to the nearest gas station for a quick workout. But what if you can't get any help or gas? Then that's really hazardous because incoming cars might not be able to decelerate fast enough and then they might crash into you. Or if the area is secluded, then you might have to walk a super long distance before you can find any help at all. So just like how we fill up the gas tank when it's low and how we always keep an eye on our gas meter, we should also be mindful of the number of pills we have left in our bottle and the number of renewals that we have remaining. So our advice to you is to always anticipate how many pills you have left as well as the number of repeats you have left. And when you see that you're on your last repeat or refill, to call our office to book an appointment. And the reason that we want to talk to you before we refill that prescription is to follow up with your health, because it may have been a long time since we last spoke with you, to see if there are any changes since your last visit with us. But also to update your list of medications. Again, always have your medications list with you, and we always ask for that every single time you come into the office. And we would also like to review some recent blood work to see how well you're tolerating certain medications and to see if any changes need to be made before we send in another prescription. And after all of that, we will then fax all the required prescriptions directly to your pharmacy. And at our clinic, Dr. Kearney's usual practice is to prescribe 100 days worth with 3 repeats, so it'll be enough to last you another year or so. Okay, so what if you didn't pay attention to your pills and now you're completely out? What do you do then? Well, again, between you, the patient, Dr. Kernew, and the pharmacist, we're all a working team. So it's very important that you keep an open communication between everyone within this collaboration. So your pharmacist can actually renew your prescription until your doctor does. But this decision is usually made based on a clinical assessment. And with this clinical assessment, the pharmacist would usually review your medication profile and ask some of the questions that are listed on the slide here. And Rami, if you have some more experience with this, I'd love for you to add some of your thoughts.
Absolutely. It's very crucial that people taking chronic medication shouldn't really stop it abruptly, especially medications like blood pressure pills, diabetes pills, beta blockers like the bisoprolol. These are very dangerous. When you stop taking them abruptly, this causes higher tendencies to have tachycardia, or if you have an arrhythmia, it will really make it worse. So it's really important to make sure that, as Dr. Kernew mentioned and you mentioned, don't leave it till the last pill. When you have at least a week or 10 days, ask for the refill. Doctors' offices are not always available. Sometimes the doctor is off. Sometimes the fax didn't go through. Sometimes there is like many reasons where a full week might not be enough. Now, you come to your pharmacy, please make sure you tell your pharmacist that I totally ran out of this medication. Is there a way I can renew it? The pharmacist will definitely clinically assist you. Make sure that you really don't have any major issues, like your blood pressure is not really too high, or you are really not having hyperglycemia, for example, which is high blood sugar because of it, and they will offer you some advice, and also they would take the professional decision to renew it for you depending on how many days. Sometimes they will renew for a week because they know that you definitely need to see a doctor in a week, or sometimes they might renew it for a month or 2 months. They can go and renew it up to a few months depending on their assessment and depending on your interest as a patient. This kind of service is crucial. We advise people always to ask for that. We definitely can't initiate therapy. So if somebody in Ontario, if somebody is having a blood pressure problem, we can't really start the medication for blood pressure because we are not allowed to start them on the therapy. They have to see a doctor and then they will start it. But we can renew a prescription that has been there for a while, and there is rules for that, and it's mainly the interest of the patient. So that's how it goes. It goes under the pharmacist name. It doesn't go under your doctor name, and your doctor will receive a note that this pharmacist, for example, Rami, renewed prescription for X, and they gave them a month's supply. Please renew the prescription for them, or the doctor might call the patient and say, I haven't seen you in a year or two. Please come to the clinic. We need to make sure that you go through the tests and all this. This renewal sometimes it has to be implemented with a fee because it goes under the liability of the pharmacist. It depends on the situation, and sometimes the pharmacist might waive that fee depending on the situation. It's not the rule, but just to let you know, always don't hesitate to ask your pharmacist about the renewal and how it works.
So Maria showed us running out of gas, and so I don't know why every day there's about 10 to 20 people that run out of gas or run out of their pills on a regular basis for us. And I know it's something that people say, well, the pharmacist will tell me. You should know. Actually, you should know. The person who should know is the patient, yourself. So let's work together, because you're going to find some surprising numbers. Is that in Canada, over 20,000 people die every year because of medical error. And the most common avoidable medical error is getting medications wrong. So think about how to not become stuck on the 403 or stuck without your right medications, and think about how to become a medical error. So let Maria take it from here.
Yeah, thank you. So again, like what Rami said, basically based on the assessment, they can refill for 1 to 3 months until your doctor is able to renew it. And again, the pharmacist's name will appear on the medication label as the prescriber for that period of time. And again, following this temporary renewal, your pharmacist can also recommend a visit with your primary care provider, who will be the one to continue the subsequent refills for your medication. All right, so another pretty important topic to talk about. So let's say this is you, the patient, and you're seeing Dr. Kernu, who told you that you should take 20 milligrams of Crestor daily for prevention. But your family doctor, Dr. John Smith, told you that you should stop taking Crestor. Now that you're getting these conflicting advices, you don't know what to do. Well, luckily, Rami, or your pharmacist, is there, and he's got your back. So Rami, could you tell us a bit more about the role of the pharmacist in this sort of situation and how you would typically handle it?
Yeah, so it's a very interesting and very important point. What happened, unfortunately, in Ontario, we don't have a way to look at medications, all of us in one pool. This is, for example, in British Columbia, this is available for all people, like for all healthcare workers, especially pharmacists, to see what did Dr. Kernu prescribe, what Dr. Smith prescribe, and we can really decide easily. So our role in Hamilton or in Ontario, when we do this, we see this happening. It happened. It's not that frequent, but still happens. We run into this, and what we do, we always give the patient the advice. For example, if we see that this example, Crestor, to skip Crestor for a couple of days or take it a couple of days, will not really cause any major harm for the patient. We advise the patient proper advice. We reach out to both doctors and we try to validate what exactly is the message. Why Dr. Kernu wants the patient to start taking or to continue taking Crestor, and why Dr. Smith thinks that the patient should stop Crestor. And then we consolidate the info and then we send it over for both doctors and we communicate it to the patient. It is happening and it's normal thing because, again, there's not a single one pool for all prescriptions to be seen by everybody. We try to moderate that and make sure that we are all consistent. Medication review does help in these cases because we can ask the patient to put in all the info we need and we fax it to both doctors and we say, you know what, it is advisable to continue Crestor, or patient is already taking statin from some other pharmacy apparently that, Dr. Kernu didn't know about. That's why Dr. Smith said stop the Crestor. That's another example. So there is definitely a good reason behind that.
So my advice is first know what medications you're taking, have an idea why you're taking them. You have lots of people to talk to. But to be honest with you, is the person who prescribed the medication or the person who's more expert in the situation is the one I would lead to mostly. And for instance, if I start you on a medication, you have an issue, I would like you to come back and let me know about it. We can discuss it because it's your body. You need to know the right thing to do. For instance, I know a lot about very little. And so in my area of expertise, I'll tell you what I can tell you. If I don't know something, I'll let you know. But please don't adjust things without really thinking about it. I don't play with my electrical panel, and you shouldn't be adjusting your medications unless you really know what you're doing. And you have lots of people to help you, so that's wonderful. Thanks so much, Rami and Maria.
Yeah, thank you, Rami. And we always encourage you to ask questions and even take notes at your doctor's appointments.
Oh, thinking about notes. What most students have is a notebook. I have 5 notebooks. I'm going to tell everybody from now on, you should have your own notebook, and you should just write things down on a regular basis, from appointments to important documents. The one time we used to give red folders with no very brought back on a regular basis. So right now I'm going to encourage everybody to take notes and write things down. Absolutely. That's a great idea. And get a notebook.
Yeah, and we also have a great video on our YouTube channel on preparing for your visit, so definitely take a look at that. Alright, so speaking of medication errors, Dr. Kernu brought this up earlier. Medication errors are extremely common and actually causes medication errors specifically causes 7,000 deaths a year in the U.S. So it's definitely something that's
70,000.
7,000.
No, 70,000. I think. Anyway, it's a lot of death. I think she's underestimated. Actually, she's right. There's medical errors, and she's saying that medications are causing 7,000 deaths. You're right.
Yeah.
There's a lot more medical errors, but I stand corrected.
Right, so the one way we can provide this is understanding which medications we're taking, knowing the dosage, and how to take it. So in a Swedish study, they examined 8 different primary care providers and their offices and found that only 16% of the medication lists on our electronic medical records at the office were consistent with the patient's actual medication use. That means 5 out of 6 medication lists used in the assessment and follow-up of the patients are actually incorrect. And this is one reason why we always ask for a patient's medication list when they come to the office or when we call them, or to bring all of their pills when they come.
Now, when I first saw this is done in Sweden, so it's not Canada. Well, you know what? Sweden is much more advanced when it comes to electronics compared to Canada. They have a common electronic medical record for the entire country. We don't. And these are people that are going to their doctors on a regular basis. You can see that many people see multiple physicians. And if in Sweden, a country that's more advanced with electronics than Canada, only 16%, I'll repeat that, if 16% of the records are correct when it comes to medications, we're not doing that much better. So what I've learned right now is that when someone sends a prescription renewal, that means you ran out of gas, there's something wrong, that I'm going to take the time to look through them just to make sure we get this right. And I'm amazed at all the corrections we're making right now. So it takes extra time, and that's why you want to work with your pharmacist. If you have trouble understanding your medications, have somebody in your family help you with that. It's hard, but realize that it's more the norm to make sure that the charts are going to be wrong than they are going to be right. So think about how we can work together about this circumstance. So I think over the last year or so, we've gotten a lot better because we're working at it. We made that a priority, and right now getting medications right is a priority. Now, when it comes to you, the patient, the client, it is said that 50% of individuals will stop or adjust their medications within 6 months to a year. It says that somewhere between 10 to 30% of people never fill out the prescription in the first place. So it's time to think about really being honest and open on what medications we're asking you to take. In many circumstances, we're asking you to take a lot of medications. And some of them are expensive, so always don't be afraid to discuss costs because there's always different options available to us. So the first step is to all work together, the pharmacist, you, the individual, and us as healthcare providers. So so I'm glad that I have someone like Rami and his team that's right in the building, and I can have discussions. In fact, we're going to talk about how our pharmacist and the pharmacy will have access to our electronic medical record and how to make a tighter connection right now for the right patients, provided you give permission for this. I think this would be wonderful. You mentioned British Columbia has access to medications, and Sweden, they have more access to data. Right now in Ontario, every doctor has a separate medical record. Every place, there's very few connections right now. So we're going to look at trying to bring down some of those barriers and work together, but you need to work on that. In fact, the app that we're developing is going to have how to help you with medications too as well. So remember that 16% of electronic medical records in Sweden are correct. I'm sure in Canada, we're not that much different.
So I'm glad you brought up the whole app idea and online prescriptions, because Shoppers does have an online refill program. And so the next few slides, I'll just be going through what the app looks like and how you can register for it. And then Rami, at the end, if you have anything to add, feel free to jump in.
So I think this is becoming more and more common amongst pharmacists. We're just using Shoppers' example because we know Rami, he's here, but you have to decide what your pharmacist, what tools they have available for you. So I don't want to make it a commercial for one pharmacist. I'm going to make a commercial to find a good pharmacist, one pharmacist that you can trust and work with, and work well with that.
Yeah, so again, don't be afraid to have these conversations with your pharmacist to really ask them about the options that are available at your pharmacy. So with the Shoppers online program specifically, super easy, just Google Shoppers and you can directly create an account on their website. And essentially what it does is that you can automatically refill your prescriptions. At the same time, you can also manage multiple family members using one account. So everything being in one place is super fast and easy and makes it very user-friendly. So with auto refill, this is just, you can easily access it on the Shoppers Drug Mart, so I'll just skip through this. But essentially, you'll be able to get pickup reminders whenever you run out of your pills, and it'll be automatically sent to your primary care provider or your prescriber. And Rami, if you have anything to add for how auto refill works, we'd love to hear it as well.
Yeah, absolutely. So as Dr. Kurnu said, this digital platform is available for almost all pharmacy banners. Just ask how it works. The auto refill, you can select from the application that we have which medications you want to auto refill. Some medications you use when needed, like for example Ventolin buffer for asthma. That one you don't want to be auto refill it every month, so you just dysfunction that aspect. You can ask for the refill also digitally when you need it. And also it has a great tool where you have your all updated medication list all the time. So when you go to Dr. Kurnu, you will be able to open the app and say, these are the medications I'm taking, and you can have it on your phone or on a piece of paper. So that's also a very important aspect, because it does not have any medications that you are not taking. It only have the active medications.
Thank you. And could you also just tell us a little bit about how someone can manage their family members using something like this?
So it gives a consent for people to take care of they are caregivers of other people, especially for older people or younger people. It gives an option, and it will be verified by email for the patient that they are authorized to do the caregiver option. So that's a very good way to take care of your parents if you want to make sure they're getting the medication on time, you're not living in the same household, and of course with your kids if you need to make sure that they fill the prescription on time. So you can definitely have that option and add a caregiver on that list.
Rami, can people can you do it for friends or next door neighbors as well?
It's a good question. I think you will be able to do it if you again go through the process online, because it will always ask for the consent of the person who's doing it. It's not going to be like anybody can do it for anyone, because there is a verification piece using your health card or photo ID on it. So.
And does it also tell you when you're going to be running out of medications well in advance? Because it tells how many refills or pills you have left as well?
It does tell you everything. It has the refill, how many tablets. It is an excellent tool. That's why, as you said, Dr. Kurnu, earlier, unfortunately, sometimes we see a little bit of frustration from some patients saying that we should tell them that they're enough. Unfortunately, we don't have any way or labor that we can print out all these, profiles and say, okay, this patient is running out of their refill, we have to inform them. We can't really do that. It is definitely a mutual responsibility in terms of patient to make sure that, I don't have enough refills, or they can ask pharmacists when they come. They can say, can I know how many refills they can, and we can on the spot do it. But there is no way that we can really predict and print a report and say, okay, this patient needs these refills or not. We wish. This digital way is way easier for the patient and for doctors and pharmacists in terms of not being aware about it. It's mainly the patient who can take control of it, and they can ask for renewal. They can even ask for transfer. So if you create a profile and you want to transfer to a pharmacy, you can also use that tool too.
Now, can this be transferred across different pharmacies from Shoppers to Costco's or anything like that? Or is it just each pharmacist has their own brand of this?
Yeah. So what happened is, if you are not a Shoppers patient and you created an account, you can ask for a transfer from the other pharmacy and vice versa. There is a way. So it depends on the the digital option each pharmacy has, but almost all pharmacies have this option now. You can ask your own pharmacy to do a transfer, your new pharmacy to do a transfer online from the old pharmacy if you moved from a place to another, or if you decide to move the prescriptions around.
Nice. Does it also say which doctor is responsible for that prescription?
The patient, the doctor name for sure. Yeah.
Great. This is a very powerful app. I didn't know it existed. I'm really excited about that.
Yeah, for sure. And as everything moved to a sort of more digital platform, it's definitely good to keep up with all the different options out there. But of course, you don't need this. So just keeping a good medications list, understanding your own medications, and having conversations with us and calling, taking notes. These are all ways that you can keep track of your own health. So don't think that you need this app, but it's definitely something that's out there that can help you. Alright, so we talked so much about getting new prescriptions and prescription renewals. How do you actually dispose of prescription drugs? Well, there are take-back programs that are located at any pharmacy in Canada and are open on any day of the year. And all you have to do is just to take these drugs back to your pharmacy and ask them to dispose of it. And when you're unable to take it back to a pharmacy or somewhere where they have a take-back program, then and you must discard it in the garbage, then just remove the medications from the original containers. Make sure you scratch out anything that can be used to identify yourself. Also hide it in something unappealing like cat litter or coffee grinds or something like that. And then put this mixture in a closed bag and then throw it out to prevent spilling. And always avoid flushing them down the toilet or the sink. That's the last thing we want you to do. So, Rami, is it true that anyone can just bring it back to Shoppers and then give it to you, and then the Shoppers pharmacy can help us dispose it? I think you're muted right now.
So, Rami's muted, but I'm going to make a comment here, is that we're going to show you some data about how long pills can last for, and I think it's about how to recycle medication. So we'll talk about that in a minute, some options. So one way is to dispose of them, and that's the current legal way of doing things, but I'm going to explore with you some other options down the road.
So basically, if you have different tablets and capsules and liquids at home, try to separate. You can put them all in a Ziploc, all the tablets and the capsules. You can put them all in Ziploc together, that's fine. Bring them to the pharmacy. We just have a disposal company that takes care of it. What we also advise with is, if you have those vials, when you empty them from these tablets and they have the label, and for privacy option, keep them empty, bring them together, we will shred them for you. So it's not only the tablet, we can shred those. What we ask is usually you can do by your part by making it easier in terms of consolidate, putting all the tablets and capsules in one, throw them all in one Ziploc, seal it, bring it to the pharmacy, and then bring all your empty vials. We will shred it with the label so that it does not have privacy breach on it if you end up throwing it in the garbage.
Mm-hmm. Yeah, thank you for those tips. And the next line is some fruit for thought for you. So a study done by the military, actually, they always have a large and very expensive stockpile of drugs, and they face toss out every few years. So Harvard did a study to see if the drugs that expired were no longer effective. And they found that 90% of more than 100 drugs, that includes both prescription and over-the-counter drugs, were still perfectly good to use even after 15 years after the expiration date. So a drug can become less effective over time, but it still retains most of its original potency. Now, one thing to note is that this does not apply to nitroglycerin, insulin, or liquid antibiotics. So these three things do expire, and be mindful of the expiration dates.
So one of the things that young people do better than old people is recycle and reuse. And so when I hear this, that drugs are good 15 years after their expiry date, this means we need to rethink about this. So the current practice right now is to do what Rami and Maria says. But I'm trying to look at a way to recycle medications and redistribute them to parts of the world or other parts of Canada or whatever. So this is not a project right now that we're doing, but something we're exploring at this point in time. Because when I hear about shredding vials, when I hear about destroying perfectly good medications, this doesn't make sense to me. And so I'm going to think about how we can make drugs last longer, share them in some way, but this is not the standard right now. But, you know, we talk about how we carve a new Canada. To me, throwing things, disposing of things that are perfectly good doesn't make sense. So more to come. So just think about that.
Yeah, that's all we have on prescription renewals. Now I'll just pass it off to Aislinn for blister packs.
Perfect. So now we're going to talk about blister packs and some other medication organization methods that can help you with your own management of your health by improving your medication adherence. So we'll cover everything from what they are and what they do to what research actually backs them up. Next slide. So we'll start out with what are blister packs. So a blister pack is a special package of your medications that is put together by your pharmacist. So your medications will be sorted into small plastic bubbles and then backed by a sheet of foil. So you can see in the example image here, there's kind of individual bubbles for specific times of the day when you are supposed to take your medications, and then each day of the week is going to be represented by a row. So in our example here, the top row there is Monday, and then each of the columns going down is basically a time of day. So going from morning to lunch to evening and then bedtime. So to take your medication, you just need to puncture or peel off the foil backing for the slot corresponding to that day and time that you are trying to take your medication for. So these packages make it really, really easy to take the correct medications at the correct times because they're pre-sorted for you by your pharmacist. And this is especially helpful if you have a complicated medication schedule. So they also make it really easy to tell if you have already taken a dose of your medication because you can see if the slot for that time has pills or is already emptied. Next slide. So what are they good for? Blister packs have been shown to improve medication adherence in patients. So that means that they improve patients' proper use of their medications and help to manage their health conditions properly. They've also been shown to have really high patient satisfaction, with people reporting that they help them to remember to take their medications on time and simplify the process of taking their medications. This can be especially helpful for seniors or for people with memory issues who still desire their independence because it reduces the risk of them improperly self-medicating. Additionally, blister packs are little to no cost to patients, but they can drastically help to decrease the cost of healthcare provision. So this is all really good to hear, but you want to have some research to back these claims up, so that's what we'll get into. Next slide, please. Perfect. So this study here was done by Bosworth and colleagues. It was done in 2017, and it basically followed 240 veterans who were all on statin therapy for their LDL cholesterol, and it followed them over a period of 12 months. So the patients were divided to either receive their medications in compliance packaging or blister packs, or they were given their medications in normal packaging and given an education session about why reducing LDL is very important for their health. So the researchers found that the compliance packaging group had a 7.6 higher rate of proper medication possession than those in the education-only group, meaning that the packaging group had better adherence to their proper medication schedules. This study also reported that the patients had very, very high satisfaction with the compliance packaging and that they found the packaging to be very helpful for remembering when to take their medications. The researchers also measured the secondary outcome of changes in LDL cholesterol, and they found some decreases in that LDL cholesterol in both groups, but there wasn't a significant difference between the groups. This could be because there was an increase in adherence to their medications in both groups, which may be because they were being followed in a study, so they were more conscious about taking their medication. But that increase in adherence was a lot more pronounced in the compliance packaging group. So even though both had that increase, the compliance packaging group increased more, and they attributed that to the actual packaging itself. Next slide, please. So this is another study, and this one was done by Tan and colleagues, and it looked at medication adherence in hypertensive patients in Malaysia who were taking amlodipine. So you can see on the left there the two examples of the packaging, with the calendar packaging having marked dates on it, and then the compliance packaging, the control packaging had no markings on it. So again, the compliance packaging was shown to increase patients' medication adherence and the percent of on-time prescription renewals. Interestingly, the researchers actually compared the cost of medical care between the two groups and found that the compliance packaging group had a lower average cost. So for the compliance packaging group, the overall cost of providing health care was around $526 in US dollars, and the control packaging had an average cost of $651 US dollars. So the researchers postulated that this might be due to better adherence to the medication that was seen in the compliance packaging group, and that would have positively impacted their health and helped to control their hypertension, leading to less necessary medical care, less frequent follow-ups, all that sort of thing that would reduce that overall average cost. The researchers also found that the compliance packaging group had significantly lower blood pressure than the control group. Next slide, please. So this is all great, but you might be wondering what the overall consensus of the research surrounding compliance packaging and blister packs is. So this is where we look at a meta-analysis. So that will take, this meta-analysis specifically takes 52 different studies, and they evaluated the effects of compliance packaging that was seen in those studies. So the figure on the left there basically summarizes all of the findings across all 52 studies. That's what all of the tiny type is on the left of the figure. That's the names of all the studies. And then each study is represented by a point on the graph on the right of the figure. So the red line that is going down the center of the graph represents where no impact would be. So if a point were to fall on that line, it means that the study found that the compliance packaging had no impact on adherence to medications. Anything to the right of that line is going to be a positive impact, while anything to the left of that line is going to be a negative impact. So you can see that the overwhelming majority of these studies found compliance packaging and blister packs to have a very positive impact on medication adherence. So at the very, very bottom of the graph, circled in that little red circle, there's a small diamond, and that represents the overall average of all of the findings of these 52 studies. And you can see that it is laying to the right of our red line, meaning that the overall consensus is that compliance packaging has been shown to benefit medication adherence for patients. Next slide, please. So some common questions. There is generally no extra cost for blister packs themselves, but you will pay your dispensing fee more often than if you were just getting a 3-month supply of medications. And this is because there's extra labor involved in packaging each blister pack, and you're getting that dispensing of medication happening more often. So therefore you have to pay for that dispensing of medication more often. Generally, packs are given on a weekly basis, so you'll get 1 pack a week, but you can discuss with your pharmacist if you need an extension of that, so maybe getting 2 packs if you were to, say, go on vacation or anything like that once we're allowed to go on vacation again. And then it might be difficult for you to get to the pharmacy to pick up these weekly medication packs, but as we discussed earlier, there is the option to have the packs delivered to you at no extra cost, so you don't have to worry about that. And generally, anyone can get a blister pack, but it's most useful for those who take multiple medications at different times of the day, giving them that kind of complex medication schedule. If you're someone who only takes 1 or 2 medications or doesn't have a very complicated schedule, then there's other options that might be better for you. Next slide, please. Or if Rami, if you have anything to add to any of those points.
No, it's all perfectly done. No, it's exactly what we all communicate all the time about the blister packs. And yes, I agree. It's one of the best, if not the best way to make make sure that we're compliant with the medication as patients.
So I was talking with Maria about this as well. So I think blister packs they help a little bit. So you're saying they're helping adherence by about 10%. They make it easier to make less mistakes, but it doesn't replace good common sense. And what I would notice in many people who it stops them from being involved in their health. So, well, the pharmacist is going to give me this bag or box every week. I don't have to really know what I'm taking. That's wrong. Is that it should be an extension of what you need to do, so it becomes easier sometimes to make more mistakes. And what I find with many blister packs, it's sometimes very difficult to know when people are going to be running out of medications. So I'm just going to ask Maria that I think for some people who want to be very active in their medications, and there's other devices to use. So you have to discuss with your pharmacist and with your doctors and your healthcare team if that's the right thing to do. What I also encourage people to do is they should actually bring back their blister pack to the pharmacist afterwards. Why? To see that you actually taken all your medications, number 1. Number 2 is that when you come to the doctor, bring your blister pack with you so we can actually verify as well. Maria, do you have any thoughts on where blister packs fall apart?
Fall apart?
Sure.
Well, I think blister packs in general is a great tool, especially if you're very forgetful. But if you are interested in taking charge of your medications, there are alternative ways to organize your pills that don't entail a blister pack. So this is a great segue into Aislinn's next section, where we do talk about these alternative methods that you can use.
Perfect. So the Dispill system is very similar to a blister pack. It's kind of laid out in the same way, with each individual segment being related to a specific day and a specific time. But this differs in the fact that you are actually able to detach individual doses. So this can be really helpful if you plan to be away from home for some of your doses of your medications, because you can easily detach them and bring them with you without having to bring the entire thing of the bulky blister pack itself. So whether you detach only 1 dose for maybe you're going out for lunch with your friends and you have to bring your medication with you, you can detach just that single dose. Or if you are going away for a long weekend, you can detach 3 or 4 days worth of medications and carry that with you. So basically, right along the perforated lines is where you break, and you can just kind of bend it and pull it off, and then you detach the backing the same way that you would with a blister pack. Rami, do you have anything to add about the Dispill system?
So this pill system is has more flexibility when it comes to not taking the whole thing, as you say. But in general, I remembered also the fact that when you are on a blister pack, regardless if it's this pill or the blister pack, you don't have, like usually, or what happen is we renew automatically your prescription if it ran out. And I agree with Dr. Cornu, that does not mean that you shouldn't really make sure that you know what you're taking or what type of pills. It's always a good idea to have that for sure.
Awesome. Well, for our next system, that could be a bit better for people who want to be a bit more involved in their medications and their health. So these are some examples of pill organizers. They may also be referred to as dosets. And these are sections similar to blister packs with individual compartments relating to individual times and days. But for these ones, a lot of the time you can either sort them out yourself or you can go through with your pharmacist to sort them. So interestingly enough, for these, you can find ones that have built-in timers and alarms that you can set to alert you when you're due to take your next dose. And similarly, you can get individual pill bottles with timers on them for the same purpose. So these systems of organization can be a bit better for people who are taking only a few medications with a less complicated schedule, but still are looking for a tool to help them with their medication adherence and managing their health. One important note is that many of these packages aren't inherently childproof, whether that be a blister pack, the Dispill, or pill organizers. So it's important, if that is something that is important to you, to look for a system that is childproof, or to make sure to keep medications out of sight and in places that are not accessible to children. All right. And then pocket pills, Maria, you were excited about this one today when you saw that in office.
Yes, one of the patients today came in with something called pocket pills. Again, it's a service similar to a blister pack in which they package all of the pills by morning, night, into these individual plastic bags. And then all you have to do is just peel off a day with the different times, and then you can just take your pills by the time, by the bag. So yeah, I think the point is that there are a lot of different ways that you can organize your pills. So depending on how forgetful you are or how much you trust yourself to remember your pills, you can look at the different options, especially if you want to take charge in your medications. Always be aware of the medications you're taking and how often you should take them. Okay, great. And then now I'll just pass it off to Stuart to talk about some of the things to keep in mind when you visit your local pharmacy.
Thank you, Maria. First wanted to just thank Kushi, who helped put these slides together. I just wanted to give credit where credit was due. Right now, I'm going to be discussing some important questions to ask your healthcare providers. Now, we've talked about your pharmacist and your primary care physicians, but another important member of your team is, of course, yourself. And so the better you engage with your healthcare team, the better you can understand how they can be of support to you, and also what you can do to also manage and take care of your own health. So what I'm going to now be doing is going over some important questions to ask anytime you are undergoing a medication-related healthcare visit. So this can go extend beyond just the role of your pharmacist and also include your doctors, any nurses that also oversee your care. One of the first questions that would be important to approach your healthcare team with are, have any medications been added, stopped, or changed, and why? When you visit your pharmacist, they would be able to provide you with a comprehensive and full list of the medications that you're currently prescribed. And this is a good opportunity for you then to keep this on your person and also ask any questions that you have. For example, what medications do, how long you'll be needing to take any medications, and if any medications have actually been added or stopped recently and perhaps you were not aware of it. When it comes to continue, another good question to ask is, what medications do I need to keep taking and why? It's an important question because some medications may actually be required for the short term, whereas others require more long-term use. For example, when it comes to short-term medications like antibiotics, just to name one, these are medications that you may be needing to take for about a week or two's time, but it's important for you to recognize that this might not be something that you need to continue to take in the long term. But had you not had discussions with your pharmacist and your doctors, perhaps you might not have realized that and would have been concerned if you ran out of pills. Other medications you may need to take on a longer term basis, for example, medications to manage your cholesterol levels. So having an understanding of how long you need to take them will also give you a good idea of when you need to get your refills, and that's a good way for you to then approach your pharmacist to get that process in motion. Again, we continue to encourage viewers to prioritize and take care of their own health, and that includes taking control over your prescriptions. And one way to do this, we mentioned earlier, was also to keep a personalized journal. So whenever you have time or you're at home and you have questions, it's a good opportunity for you to write them down so you can approach your pharmacist or your physician the next time you have a visit. Another good question to ask is, how should I take my medications? A lot of times this information will be labeled on your bottle, but if you are concerned about how to take your medications, it's always a good idea to either give your pharmacist a call or visit them if they are doing in-person visits at the moment, just to get a good understanding of how to take your medications. We also talked about, as Aislinn mentioned, many different options for how to organize your pills. Some options that are more perhaps convenient and other options that provide you with taking a bit more control of your medications. So asking the question, how should I take my medications, is certainly an important one if you are unsure. Another good question is, how long should I use this medication for? As I mentioned, some medications are more for short-term use and others are for longer. Another great question is, how will I know if my medications are working? For one example, diuretics or water pills are medications that may need you to use the bathroom more frequently, but are effective to help you manage your high blood pressure. Knowing this will be beneficial so that there's no surprises when you begin to take the medication. Oftentimes, when physicians are prescribing medications, they obviously know the effects that it will have on your body, and so this is something that you can certainly approach your pharmacist and your physician with, so that they can explain to you what potential side effects may be, and also what potential effects it may have on your body, for example, the frequency at which you use the bathroom. Another great question is, do I need any tests, and when do I book my next visit? So here at the clinic, we are doing virtual lab requisition forms. We are able to send your requisition forms via email, and your pharmacist will also be a member of that team who can also assess when would be a good time for you to have another blood test. And that can also be used to see if your medications are being effective in managing, for example, your cholesterol or your blood sugar levels. And a final good question to ask is, what lifestyle changes can I implement to be proactive about my health and my well-being? As you may know, medications are just one part of the story, but there's also diet and lifestyle changes which can have an important and drastic effect on your overall health and well-being. And so speaking with your pharmacist and your physician about what sort of approaches you can take in this regard is also a good question that you can approach them with. And finally, making sure that you answer your questions honestly is very important. For example, drinking, may actually interact with some medications, which we're going to talk about in a few slides. So being honest about your smoking and drinking habits will help your physicians and your pharmacists make informed decisions about your care. And before we move on to the next slide, I wanted to ask Rami, are there any particular questions that you wish a patient often asked more in your daily work?
I mean, well, we don't have, like, we like to hear questions about, what mainly the over-the-counter usage. We also like to patients to ask if what kind of things they can do over and above what they take in medication. So what we call non-pharmacological interventions, like diet, basic diet, advice, some of the useful vitamins that they can use depending on their situation. These things are really important, but all the questions, there is no silly question. All questions are important. In some cases, we find out that patients didn't ask a question and it caused harm when they didn't actually. They are embarrassed to ask, or they, they might think that it's not really important, but there's nothing wrong with asking a question. The accessibility is very crucial for for the accessibility of the pharmacies in general is a very big piece for our patients, and that makes life easier for patients too.
So I just heard that Rami has to go take care of an emergency. He's going to take off for a little bit. But before he goes, we're just going to just talk a little bit about just generics and drug plans just before you go, Rami. Would that be okay?
The reason is, I apologize, it's just we're preparing, apparently, as you might know, that today the government said that they will launch the vaccine in other areas, the COVID vaccine, through pharmacies. They already started with Toronto, Kingston, and Windsor in the last couple of weeks, and apparently Hamilton is one of those. And I think, from what I understand, I've received communication just a few minutes ago. Apparently, it might start with us by next week in Hamilton. So that will require me to fill some online stuff last minute, because we have to be prepared for it. So I apologize sincerely. So I can speak about the generic versus brand. We all know that brand name is actually the one thing that a manufacturer, like any company that do research, they spend 10 years on doing the research on a medication, and then they end up with a new medication or category of medication where they would put the price of that medication. Part of the price is the investment that they have done in reaching out to that medication. And that gives them the monopoly to have only that medication for few years covered, or not replicated by a generic company for 10 or 15 years, depending on the country and on the regulation. And then generic will be the Me Too product, where it has the active ingredient, it has a different, in terms of, it's not exactly the same additives in terms of what's added to the active ingredient to make the tablet, but it's actually bioequivalency wise. In Health Canada will give the generic the approval if they are 10 or 15, if they are like around 90% bioequivalence to the brand name. The difference in the price is huge. It's usually only 20% to 25% of the brand name, and that gives us, as a universal healthcare system, it gives the government more space to cover more people on the medication. So, is the brand better than generic? Well, it's a relativity thing. If you think of the fact that most of the people on generic, they are controlled, well controlled, there is extremely few cases where people might not really tolerate a generic, not because it's a bad thing, just they would have better outcome with some of the brand medications, and that's something that happens, but it's not significantly big. So that's mainly the main differences between generic and brand. Why the generic is cheaper? It's simply the generic company did not pay any penny on the research, which is the biggest cost when it comes to finding a new medication.
So that's wonderful to know that. So what we're saying is that brand name drugs and generic are so-called bioequivalent when it comes to the active ingredient. The cost is hugely different, so you have to decide if that works for you. And there's now programs available that allow you, and sometimes to get the brand name at generic cost, so we can come back a little bit later. But before Rami goes, I just want to talk about dispensing fees.
Yeah, so we'll just skip ahead. Maybe if you can close your eyes, this is going to be a spoiler, but let's skip ahead to the co-payment programs.
So co-payments and working with your insurance company, can you just give us a few thoughts about co-payments and dispensing costs a little bit there, Rami? Can you give a little information on that?
Yeah, absolutely. So, seniors over 65, there is two different categories. If you are a single senior with an annual income less than $19,000, or if you're a couple and your annual income is less than $32,000, you are able to apply for the co-payment waiver, which means you will not pay you might be paying $2 for each prescription. You will not pay any dollar for that. If your income as a senior is over 19,000 or over 32 as a couple senior, you will be paying $6.10, or actually most of pharmacies are now $4.10 for each prescription you do if it's covered. So make sure, many seniors I know, they are not aware about this rule. They make less than this and they don't realize that they will not pay deductible, they will not pay the co-payment if they just apply. It's a one-page application. You can ask your pharmacist about it. We can print it online right away and give it to you. It takes you only a couple of minutes to fill. It's really a simple form. You mail it, the mail, yeah, I see the form here, and then in like 4 to 6 weeks usually, the government will send you a confirmation that you are included in that. It only needs a copy of your notice of assessment for the previous year. That's the proof that you have lower income. So that's exactly what it is.
Can you also say a comment on the Trillium program?
Of course. So Trillium program is actually the program. So we talked about 65 plus. We also, just to include people under 25, if they don't have private coverage, they are covered by the Ontario government for medications. If they have private plan, they are covered by their own private plan. People between 25 and 65 or 64, those people are actually covered. They can get coverage by the governmental Trillium plan. So in simple words, it's like an insurance plan by the Ontario government. You apply for it if you are not really low income, you are in the middle, you're not low income, you're not really high income. You can apply as a household for the Trillium plan, and when you apply for that, you are eligible for to get covered for your medication, and you will be paying only every 3 months. The government will decide that your deductible is $200, for example, based on your income as a household, and you pay the first $200 of any cost of medication. So somebody asks logical question and say, well, I'm not really filling any prescriptions, I'm healthy. That's great. My advice, fill these forms, keep them, send them, be on the plan. What will happen if you get sick and you get one medication? Some medications might cost you $300, $400, $500. It's always good to be ready with a coverage plan, especially people with small businesses. They don't really have a corporation that pays for their drug plan. It's always a great idea to go with Trillium plan. So there is an application. Again, we can print it in the pharmacy, give it to people if they don't have any printer. They can fill the form. We can also give them tips about the important things to fill, and also they will need their notice of assessment to send it with the application. They are not supposed to show this to anybody, including their pharmacist, but at least make sure you understand the application. It's not that complicated, but it's very important to fill it properly. And then again, it takes 6 to 8 weeks usually to get it authorized, and you need to update it on an annual basis. So every year, make sure you fill your paperwork for the Trillium plan. I encourage people who have medium income and they really don't have any coverage by any way, fill this form. It's very important.
So it's really important to always discuss the finances, and you can see there's things available. One final thought, if that's okay. There's things like drug recalls from time to time, and one of the issues about Zantac. I wonder if you could just comment on that there, Rami.
Sorry, before we go on to that, just a note for everyone that's watching, the application, links to the applications for both the Trillium drug program and the co-payment senior program are in the description box of our YouTube video, so you can just click on that to apply to these programs. But yeah, back to the schedule.
So we're going for a potpourri of different slides over here, and we'll come back to that. And so one of the things is that can you comment on Zantac there, Rami?
So,
and just also drug withdrawals and availability of drugs.
So that's an example so recalls of drugs happen. Usually manufacturers might find out that their drug doesn't have the right concentration, for example, of a medication, or it has an inactive ingredient, an unactive ingredient that might be discovered as carcinogen or as toxic for patients. They do a voluntary recall where they recall the product till they change the whole recipe in order to make sure it doesn't have that part. So Zantac was a big thing in 2019. They ended up withdrawing it from the market, and they found out that almost 99% of the generic use the same non-active ingredient in it, and that's why the ranitidine was withdrawn from the market. There is only now 1 or 2 ranitidines available in the market, and those ranitidines are really they are available in the pharmacy, not over the counter. So that's one of the things about Zantac. Recall can happen also for printing mistakes. If there is a wrong, for example, one of the birth control pills was withdrawn 3 years ago because it did not have the right print on some of the blisters inside the birth control pill. So they do that in order to make sure people don't take the medication in the wrong way. Sometimes they might find there is a mix of pills in some bottles because they use different lines or same lines to produce different medications. So if a company is doing 300 molecules, they don't have 300 lines in the factory. They might have 50 lines, and these 50 lines, with the proper manufacturing practice, they use them to produce like 6 different molecules. So that's why sometimes there might be some challenges. Luckily, we have a very good system in Canada where the companies can come forward and say, we want to do a voluntary recall, even if they're doubting something. And I'm not paid by these companies, but it's a very transparent and very efficient way to recall these. And in many cases, it's more of a better safe than sorry approach. So that's one of the things they do, and I agree with it. It's a very good way to withdraw it. So far, Zantac, we advise people that famotidine, which is a good replacement for ranitidine, and there is 1 or 2 generic that are available now behind the counter.
Well, thank you, Rami. I know you have to take off there, and if you can join us after you've done your duty there, we really appreciate it. And just from my perspective, you can see that life is complicated. Drugs, ingredients come from different parts of the world, and they have to be put together, and they have to be available. And lots of questions from lots of people at different times. So, Rami, thank you very much. And again, your pharmacist is always a key to our success. So we're going to go back to some of our slides, and I think we'll leave off.
Thank you so much. I apologize again, folks, and thank you very much for this. We will definitely, this is one of the best presentations actually I've seen. We must redo something in a month or two, and we can dedicate something about coverage also. I appreciate your understanding, and next week we're going to be also busy with the vaccination, so we will see you around.
That's exciting, because what I'm going to say about vaccinations in general is that we're far behind other countries, and now it's time for Canada to catch up on that, and so making it more available and Pharmacist is a great thing. And I will just say this, is that the amount of vaccines available is not enough. It's going to get greater. People are worried about the AstraZeneca vaccine. I'm not worried about it right now. 15 million people have been vaccinated. There's been about 30 cases of blood clots. And in Canada so far, we have over 22,000 people have died from COVID. So look at the numbers. So I'm pleased that I got my first dose of a vaccine, and I like the idea of it sharing the vaccine, so second dose being delayed, and that's probably going to be a good thing. What people don't know is prime and boost is something that's important, is that the first, delaying the second dose can actually increase the effectiveness of the vaccines in general, so that's a good thing potentially. Also, is that there's just so much learning, and the thing about science, it changes very rapidly, and so what we say today changes tomorrow, and we in healthcare are used to that. Rami has to go off and take care of an urgent matter. No apologies necessary to do a great job. And to me is that the public needs to be aware that science changes, and you need to get the best information from the people who know the most, and that's people in science. So trust science is my advice to most people. So let's go back to, I think it's slide 35, and we're going to look about how to read that pill bottle.
Thank you again, Rami.
Thank you, Rami.
Thank you, sir. Thank you, everybody. Thank you.
All right, Stuart, if you want to take it over.
Yes, thank you. So if you just want to click one more time, we'll go through some of the labels that you might expect to see on some of your pill bottles, just to clearly outline what everything means. So the first option that you're seeing right here outlines your pharmacy address, your store number, and your contact. At Dr. Kernu's office, it's important that we know your pharmacy address so that we can continue to fax and be in contact with your pharmacist. So whenever you visit the clinic, it would be a good opportunity to share with us your pharmacy address just to make sure that we have it on your chart. The next option that you see right there, it relates to how many refills you have left. As Dr. Kernu mentioned, he typically prescribes 100 for 3 refills. It's a good idea to keep track of that number to understand when you are going to actually need your prescriptions to be renewed. And then that is a conversation that you can approach with your pharmacist and your healthcare team. Right beside it, you'll see the prescribing physician. As Rami mentioned earlier, if you ever do run out of refills and you temporarily need to have your bottle renewed, the prescribing physician there would actually be your prescribing pharmacist for a temporary amount of time, until your primary care physician is then able to go over your records and then prescribe more refills for you. The next option is a direction on how to appropriately take your medications. All medications need to be taken differently at different times of the day, some with food, some without food. So the big capital letters in font bolded print clearly just outlines how you are expected to take your medications. And again, if you do ever have any questions, this is a conversation that is certainly appropriate to approach with your pharmacist. Next, you will see that we have the medication name. Sometimes both names will be labeled on the bottle. This is one of the medications, and it also indicates the dosage or the strength beside your medication name. And finally, you'll see right on the bottom left corner, that's how many tablets are in each bottle. So in this case, the patient has 6 refills for 30 tablets. So if you add all of those up, you'll know how many tablets you would have to last with taking 1 tablet a day. And as we transition over, especially, we can actually go back one more time. Sorry about that. It's especially important to, again, keep a close eye on how many refills you have left. And as I mentioned, doing the calculation for how many days that you have left is also an important thing to do. And again, you can do that by counting the amount of tablets you have and multiplying it by how many refills you have.
So it's very important that every drug has 2 names. It has a generic name, which is the chemical name of the drug, ASA, for instance, and it is, and then the trade name, which is Novacin. So realize that most people don't know both names. Try to realize that. So when you're trying to describe the names of the doctor, try to pronounce the one that's easiest to you. Know spelling if you can. Have your glasses with you so you can actually see. And have your pills available when someone calls you up about your medications. Stuart, what percentage of people or electronic medical records are right? Do you remember what that number was?
It's only 16% that is correct.
So that's really important to realize that most things, that's why I need to check and keep getting better. The airline industry has made a general rule about safety by constantly having checklists. So we need to learn from that in the medical field, and I think that's really important. Thank you for sharing that.
And if we move on to the next slide, I'm going to briefly discuss med checks. Rami briefly introduced it earlier, but I wanted to just provide a little bit more detail on what a med checks program is. So med check is an opportunity for you to have a one-on-one consultation with your pharmacist. And during this consultation, your pharmacist will review your prescriptions as well as your non-prescription medications, including your vitamins and your supplements. This will provide you with an opportunity to then get a medical document, which is signed by your pharmacist, which will contain all of your medications and will be good to help verify the current medications that you are taking. This will be always good should you ever lose your medications or should you travel, hopefully sometime in the near future. There's no charge to a meds check. It is completely covered by the government. And this is often something that, if you do need, traditionally is done on an annual basis. Any Ontario resident who's currently taking a minimum of 3 chronic medications is able to have an annual meds check. And the patient, as you see right there on the final point, they are eligible for 1 annual checkup a year. Now, you can often think of a meds check somewhat like an annual physical with your family physician. If we move on to the next slide. These are some of the points that I just wanted to briefly touch upon. You can see that today, with the COVID-19 pandemic, this is something that is often being prioritized over the phone as opposed to an in-person visit. Now, this may vary depending on your pharmacist, so whether you would like to call your pharmacist and ask, or whether it's something you need to make an appointment for online, it may vary. Now, when it comes to patients, you need to bring all of your over-the-counter, natural, and other pharmacy medications. If necessary, changes will be recommended and faxed to your primary care provider. Patients will then obtain their full medical profile, and you can do a follow-up, which is usually done every 2 to 3 months, and this is especially prioritized for patients who are currently diabetic. Now, in this meeting, you have an opportunity to go over why you are taking medications, the purpose of the medications, and any questions that you may have. And your doctor and nurse can request medication reviews as well for you to undergo with your pharmacist. Now, one thing that may also come up in these opportunities is your pharmacist may ask questions such as allergies. So they may ask, for example, whether you've had any major or minor side effects from medications you've taken in the past. Should you realize, or your pharmacist realize, that, for example, you have more of a sensitivity to a medication as opposed to a full-on allergy, this can be important because this will not restrict a physician when it comes to prescribing something in the future that may be life-saving, such as antibiotics. So having these conversations can come up and bring up new information that you hadn't realized or considered that your pharmacist can maybe shine a light on. And if we move on to the next slide, we are then going to transition into discussing a little bit more information on generic versus brand or trade names. What is the difference? And we're going to discuss a little bit more on this topic beyond what Rami had discussed previously.
So to me, this is actually quite an easy discussion, and that the actual active ingredient is the same. That's effective. So Lasix is a trade name. Furosemide is a generic name, and when the drug reaches a certain time frame, and that's going to change as new agreements are being made with the Canadian Pacific Agreement, is that you get the same effectiveness. So for a generic company to get approval, it has to say it's bioequivalent. It has to show that effect. And the good news for consumers is the price is dramatically lowered. So that's important. Now, what Rami points out is that the trade names, companies have done the research. So right now is that Pfizer and Moderna have developed COVID vaccines. They have sole propriety rights of producing that vaccine. They control the quality of it, and they just don't give out the formula to just anybody. So it's important that we understand that. What we also have to realize is that affordability of drugs is becoming a big problem, so we have to look at those effects. Next slide, please. drug recall, we talked a little bit about that before, is that your pharmacist will know which batch is being recalled, and your pharmacist can tell you whether or not your drug is being recalled. Next slide, please. We just talked about Zantac as being an example of that, and that's important. Drug interactions. Who's talking about that?
Hafsa, I believe. So if you're there right now, feel free to take it off.
Hi, so I'm going to be speaking a little bit about drug interactions. So you can go on the next slide. Okay, so just starting off, drug interactions refer to interactions between a drug and another substance that prevents the drug from performing as expected or performing optimally. So drug interactions can impact the absorption level of the drug, they can cause unexpected side effects, or they can increase or decrease the action of the particular drug. So in the next few slides, I'll get into some examples of these. So can we go to the next slide, please? So the types of drug interactions can be broken down into three broad categories. The first one is drug-drug interactions, which occur when two or more drugs react with each other. So this could occur if different doctors prescribe different drugs that don't necessarily get consolidated. So like Rami mentioned earlier in the presentation, if you have medications from different doctors, it's important to let your doctors and pharmacists know so that they can take that into consideration when prescribing you with an additional drug. So just an example of a drug-drug interaction, iron supplements may interfere with the absorption of other medications like penicillin, for example, and vice versa. So for this reason, it's recommended to take your iron supplements at least 2 hours before or after taking other medications. But if other medications are not taken into consideration, that could be problematic. So the next broad category is drug, food, or beverage interactions, which result from drugs reacting with certain foods or beverages. So for example, eating certain vitamin K-rich foods like spinach or kale while taking warfarin, which is a blood thinner, can reduce its effectiveness. And then the last category is drug-condition interactions, which may occur when an existing medical condition makes certain drugs potentially harmful. So an example of this is if you have high blood pressure, you could experience unwanted reactions if you take nasal decongestant. So just moving on to the next slide, what are some drug side effects? So all medications actually have side effects, and it's important to ask your doctor or pharmacist for what to be cautious of, especially when starting new medications. And it's very important to stay in touch with your pharmacist as well when starting a new medication, because sometimes you may not even realize that what you're experiencing is actually a side effect. So for example, if you have a skin rash, you might just assume that it's an allergic reaction, but it may actually be a side effect. So just staying in touch is very important. Also, the warning section of the label provides important drug interaction and precautionary information. It includes information like when to talk to your doctor or pharmacist before use, the medical conditions that may make the drug less effective or not safe, under what circumstances the drug should not be used, and when to stop taking the drug. So here's an example of a label for the acetaminophen drug, which is a pain reliever. So you can see that there's information about what to be cautious of, and even just the last line on there, you can see that it says like ask a doctor or pharmacist before you use it.
Use Dr. Kearney, and it's about pharmacy and drugs and keeping up to date and the side effects. And
sorry, is someone saying something?
some parts are good. They just got the news. It's a guy from.
So yeah, it says ask the doctor before
shoppers.
taking the blood thinning drug warfarin. So it's important to read through the labels as well and speak to your doctor or pharmacist.
Mainly it was Toronto pharmacies that were doing it up to now.
Sorry, Hafsa, I'll just stop you for a second. Is someone speaking?
There's some good news. They're going to be dispensing the vaccines.
Okay.
From next week.
Okay,
From
so
next week. Well, shoppers in Hamilton. That's all I know. I don't know if it's our branch or whatever.
is that I'm sorry, we had some interference here for a sec here. Okay, so we'll see if we can try again here. So one of the things I want to say about side effects, drug interactions is it is quite complicated, and you need to rely on people who prescribe the drugs on a regular basis to understand this. And we can also say just because a list says something doesn't mean you're going to have that. And most of these lists are legal documents, and they list just about anything. You have diarrhea and constipation simultaneously. It doesn't make sense. And we've created certain diseases by putting power suggestion, and you can, if those are interested, can look at the statin debate issue. And I just think this is, I'm just truly amazed how good our drug system is, how extensive the testing is. and how effective things are. But there's always room for improvement and learning. So go ahead, I'm glad to hear what you have to say.
All right, so we can move on to the next slide. So the last thing I was going to talk about was discontinuing drugs. So in general, you should never discontinue a drug without consulting your doctor, and doing so could lead to major side effects, including physical, mental, and emotional symptoms. So an example of this could be just discontinuing blood thinners like Plavix suddenly can lead to the adverse effect of blood clotting. And I also want to mention that if discontinuation of a medication is actually necessary, the doctor will assist you in planning a gradual discontinuation to help optimize the outcomes. So yeah.
So we did discuss some of this with Rami already, especially the Trillium program and the co-payment program. But I'm just going to start off with talking about ways that you can maybe help with cost. So something that you can do is using a pill cutter or a pill splitter to save money on some prescription drugs. So pills that can be split safely are those that are FDA approved, permitted by your doctor or pharmacist, and have a little score or dent down the middle.
So this is actually quite interesting, is that you're going to have to rely on people to help you with this here, is that if it's non-scored, the manufacturer cannot guarantee half the drug in each part of the pill, but chances are it's still good. So if you come to statins, they're all the same price. So 80 milligrams of Lipitor and 40 are the same price. So if cost is important, you can just split the 80s in half and save half the cost of that. Some medications cannot be cut or scored. Obviously, capsule cannot be, but this is something that I've been doing quite well, or taking medications, certain medications, like 3 times a week as well. You have to know the half-life of the drug. That means how long the drug stays in your system, and how this works over here. So I'm a big fan of pill cutters, but get a proper pill cutter. They're about less than $10, and here's one from Shoppers.
Yeah, for sure. So definitely invest in getting a pill cutter. Doing it with a knife would be extremely difficult, so just invest in one. Yeah, so now that we talked about the different drug programs, let's talk about the Ontario Drug Benefit Program. That's for seniors aged 65 years or older. So this is your typical plan that covers all seniors when it comes to prescription drugs, and it covers almost 5,000 products that are all listed in their formulary on their website. And so you can also qualify this if you're 24 years or younger and are not covered by a private insurance plan. So this is something to look into. And this slide only covers a few of the things that are listed on their website. So again, we link that in the description, and we highly encourage you to take a look for the full coverage.
One thing to measure in Ontario, there's a process where a drug will receive a general listing. That means when the doctor prescribes the medication, the pharmacist will dispense, no questions asked. There's other things called limited use criteria, is that you have to meet criteria set up by the government for the drug to be approved. I'll give you an example right now. Ozempic is a drug that's about $250 a month, and it's been approved for diabetes, and it's recommended not as first-line therapy, but after trying a few medications. But it's up to the doctor's discretion to use the medication. Now, it's also a drug that is really quite useful for weight reduction, but it's not an approved indication for the drug in Ontario. So, if it is prescribed over the age of 65 years of age for weight reduction, that's not the intent of the government's prescribing habits. And so you have to discuss whether or not that's really in your best interest to do something that's not approved. But that's a separate discussion. For instance, blood thinners, warfarin, we mentioned before, we mentioned that's affected by vitamin K, is a few cents a day, where there's newer agents called NOACs, known as Pixaban, Pradax, Edoxaban, Xarelto, for example of those drugs. They cost about $3 a day. And so the government has set out some criteria for them, who can get them, who cannot. And you need to put a limit use code to get that. Now, when do you apply the rule of that, and when do you change that rule and things of that nature? That's a discussion you need to have with your doctor. There's also something called Section 8, for very expensive drugs that you can write a letter to the government and it has to be reviewed in great detail before that drug is approved. That's in diseases such as pulmonary fibrosis, Fabry's disease, etc. So it is complicated, but what's truly amazing in Ontario, we have a very generous drug prescription plan, and I think we can effectively treat most people very well for most of our diseases. So, but we are spending your money, your taxpayers' money, and that's going up extremely very high rate on a regular basis. So we have to decide how to get good value for what we're doing and prescribe good medications. So very, very interesting.
Right, so now that you're covered by this program, what do you actually need to pay? Now this, once again, it depends on income, and it is also classified for seniors who are single and seniors who are living with a spouse, and they look at your combined income for that. So depending on your income, you do have to pay a deductible fee, and this is essentially the first $100 of the total prescription cost of each program year, and one program year is just August 1st of one year to July 31st the next year. And in addition to the deductible, there's something called a co-payment, and this is a fixed payment for each prescription of up to $6.11 in addition to the deductible. And like the program that we discussed earlier, the senior co-payment program, that program essentially reduces the co-payment fees and also just takes out the deductible. And again, you can also request for a 3-month supply of some of the drugs that you use to treat certain chronic conditions. These include your diabetes drugs, the ones to treat high cholesterol and high blood pressure. So because you get a 3-month supply, it means that you will have to pay the co-payment fee less often because you'll only have to renew that prescription once every 3 months.
So you can decide what your doctor and your what is best for you. Now, the initial prescription for what government pays for, they give the first supply is 30 days, and that's actually a good rule because if they give you 100 days of a drug that doesn't work for you, for the first time 30 days, then you can go to your prescribing habit. So, what I tend to do, that's why I give it like a 100-day supply with 3 refills. So, if you're taking a chronic disease, I think giving a prescription for a year plus is a good idea, but you want to make sure and check in to make sure it's still the right dose, the right medication, and things are going well about that.
Yeah, and again, for both the Trillium drug program and the senior co-payment program, feel free to access the links in the description box of our YouTube video to access the applications.
And if we go back to the Trillium program, which is really an important program, it sets a limit on what you need to pay for drugs, and especially if you get one of these rare diseases that's very expensive, you want to make sure that you can get adequate treatment, and the government's made that possible. But like any government program, there is paperwork, and you can get this online. You can see where that is, and the pharmacist is really very important people to help complete that. So that's something to consider when necessary.
Alright, so again, these are the instructions of how to apply to the program.
That's actually kind of an important over here. If you go back to this over here, is that I didn't realize that until today. See, I didn't realize that there's apps available to manage your medications. We're in the process of developing an app, and maybe we should redirect that and actually work with other people to improve on their apps and how to share that information. So don't be afraid to discuss costs because it is really important. Some of these medications I can't afford. And so be very, very, don't be afraid to say, I have trouble paying for these medications.
And that pretty much concludes our entire presentation today. And just on a final note, we are having a medication list, a raffle activity. So we'll be sending out a form, and the form will also be accessible in our description box, where we encourage you to submit a copy of your medication list, and then we'll compare that medication list to the one we have. So make sure in your medication list to include the ones that Dr. Kernu is responsible for, as well as the number of renewals or repeats that you have remaining for each medication. And for everyone that sends in a medication list, you will pretty much redeem one raffle ticket. And for those whose medication list matches with the one that we have on our system, you win 5 raffle tickets. And all of these tickets will be going to a pool for a chance to win a prize.
So what we decided to do is that we're going to have different get-togethers at different times, and we're going to hand out raffle tickets. And basically, what I want you to do is send in a medication list, send it to drkernu@232gmail.com, or anytime you come to the clinic, you can hand one in and get a raffle ticket. And if your list matches ours, you get 5 tickets, and those will be draws for house prizes in the future, from things like books, health care, snacks, and the most important one that Maria wants to give you is something called a Fast Pass. A Fast Pass is basically a ticket that allows you to skip the line. Right now there's no line to skip at the office because of COVID, but I'm looking forward to seeing a busy waiting room one day again in the future. Maybe not as busy as it ever was before, but it's really important to give you the proper information at the right time. So take a chance and send your medication list in. Include your name, your date of birth, so we can make sure it goes into your chart, and then we'll have those raffle tickets. I hope everybody gets 5 raffle tickets. And please also list all the pills that I'm responsible and the pills that I'm not responsible for as well. During the pandemic and other times, I don't want people to be short of medications, and I'm glad to fill out most medications that you need. Don't ask me about narcotics and antidepressants. I'm a lousy psychiatrist. I cause depression and anxiety most of the time, I always say. My best cure is regular exercise, but I think it's important that we all work together. Next slide, please. And this is actually Bruce that came in today. So Bruce, you're going to get 5 raffle tickets. What happened is that he came in with his list, and it was perfect. And he said, I can't remember my medication, so I keep a great list today. So thank you, Bruce, for coming in today. And you're the first. You get the first 5 raffle tickets. And Aislinn and I met Hazel last Sunday. So what happened is that we were privileged to get vaccinated, and the first mistake I made about vaccination is that I was assigned a higher priority than some people, as I was seeing older, sicker people, and on a Sunday, getting off my bike, I got called at 1 o'clock in the afternoon and said, we could do your vaccine today or tomorrow. I said, well, I'm at home right now. Why don't I just delay it till tomorrow? Guess what happened? The government changed the rules. That got canceled, and a couple months later, or I'm not sure, it seems like a couple months, maybe it was shorter than that, I got another call on Sunday coming off my bike, again after a little ride. So I was fighting COVID in 2 ways: by getting more fit. By being more fit, you decrease respiratory infections, keep your weight down. And then I got a call saying, we can schedule your vaccine. I said, when can I get there? And she gave me an appointment within an hour. I just had a quick shower and went off to get my vaccine. And as I was walking out, Aislinn's walking in. So Aislinn is one of our superstars here in the clinic, and she's around high-risk patients, and she got vaccinated. And I got vaccinated for 2 reasons. One, I'm older, I'm 62 or 61, and I'm at a higher risk for complications, but I also worry about spreading the disease, and that's what really worries about everything. Aislinn got vaccinated to prevent people from getting sick. So all the vaccines that are currently available are about 90% effective at decreasing hospitalization and death from COVID. Some are a little bit better than others, and we can argue about what is the world's best vaccine. Is that they're all great vaccines. And I have to, we talked about generic versus trade name. It is the pharmaceutical industry that came up to the plate that is saving the planet with the vaccines, because they are 90% effective of severe disease and hospitalizations, and they're also shown to decrease spreading of disease as well. Now, I can't comment how great that is. It looks like it's too good to be true, but it may be up to 90% effective. I don't really have a great comment on that. I'm really impressed at the vaccination centers. Once you're there, it's great. Getting there is a huge challenge. So my advice to you is get there as quickly as you can. And if someone calls, say I'm dropping what I'm doing if you can, and get vaccinated. And basically gives us a wonderful opportunity to move forwards right now. So lots of information today. That's the last slide.
Yeah.
So that's our last slide. Let's go back to the medication list. So I want people to think about filling out this form and keeping your copy in your wallet up to date, or on your app on your computer. Take pictures on your phone. Make sure you know exactly what you're taking, when you're taking, who's prescribing as much as you can. Is that working together with your healthcare team and using the appropriate therapy. And I want to thank Maria and all the participants and Rami's downstairs right now trying to organize vaccination in the pharmacy here as well. So, and that just came up all of a sudden. You can see healthcare is changing rapidly. Science is changing rapidly. Keep yourself up to date. I have so many people to be grateful for, and I think I'm going to stop over here. Maria, what else do you want to say tonight?
That's pretty much it. If you have a notebook, bring it to your next visit. Always keep a medications list on you, and don't be afraid to speak to your pharmacist.
Stuart, any comments there?
No comments at the moment, but if anyone does have any last-minute questions, I encourage you to put them in the chat, and we'll be able to answer them.
Now, and Aislinn and others who have participated, any comments we forgot to? I know we had to reverse the order a little bit. Thank you for your understanding. Any thoughts from anybody else? Quietness from everybody. Well, any questions in the chat box there, Stuart?
Not at the moment, no. I think we covered a lot, so no questions at the moment. No.
Well, it's funny. This month I got basically 2 vaccines. I got Rami to give me my shingles vaccine, and the Hamilton Health Sciences my COVID vaccine. So I've learned so much over the last 35 years, and what I learned is that when we're working together and you take steps to improve your health, one of them is using the right medication at the right time. What I do find is that many people are not really totally honest about their medications. And medications only work if you take them, and they work best as prescribed. So if you have an issue, don't be afraid to discuss them with your healthcare providers. And I'm always open to, if I prescribe you medication, you have an issue, please call, book yourself an appointment. Love to hear more about this. But I learned so much today. And I'm learning every day, so I want to thank everybody and wish everybody a good night, and be safe. And by the way, if you want to know about fish oils and whether or not you should take them back, go back to Wednesday's one. There's just so much good information out there, and I thank Stuart for organizing all these, and I thank everybody for participating, and you for having confidence and for allowing us to look after you. And have a good night, everybody.